Hello, today we have speaking with us Dr. Keith Carter, who is the professor and chairman at the University of Iowa Department of Ophthalmology. Welcome, Dr. Carter.
Thank you for having me.
I just wanted to get your perspective about what made you go into medicine.
Well, I started off in pharmacy school. I had a inkling for medicine. Had a family member that was a pharmacist. Enjoyed what I saw him doing, but once I was near the end of pharmacy school, I realized I wanted to be more involved in actual treatment of patients, and that's why I went to medical school.
And what made you decide about ophthalmology?
Well, it came down to ophthalmology or orthopedic surgery, which are two contrasted fields. But really, it was driven by technology. Ophthalmology was on the verge of using lasers and things of that nature, and it was a clean field, and it was a field that allowed you to see all age ranges from kids to adults. And so that interests me, and that's why I chose ophthalmology.
And as far as when you tried to get into ophthalmology, I know I had my own personal struggles in trying to become an ophthalmologist. Did you face any difficulties on the track to ophthalmology?
Of course. I mean, ophthalmology is one of the premier subspecialties, and it's very competitive. You don't really have a lot of role models to ask for help. I think we're better suited for that today than it was 25 years ago. I was fortunate enough to have some people that assisted me based on my work, and I thought my work was very important. I think it's very important for anyone aspiring to go into medicine and go into the competitive subspecialties to work very hard and do a good job and show that you're as competitive as the majority student.
And now I know that you're the chairman of a majority institution, and I'm wondering how you decided from your residency to become an academic physician.
Well, that was a tough decision. When I was finishing my fellowship training, my plan was to go back to my hometown, Indianapolis, to go into private practice. Had gotten to the point where I even had an office building selected, a line of credit application from the bank, and the equipment. But I sat down with some of the people who had led me through my career and advised me, and one of them actually delivered me. He also wrote me letters for pharmacy school, letters for medical school, and I went back and met with him. He's the CEO of the big hospital in Indianapolis, and he told me, after we had a long discussion about the pros and cons, he told me I can always come back home to Indianapolis, but I'm not going to always get a chance to do academics, and he recommended me to pick the best academic job and give it a try. So that's what helped me make the decision to stay at the University of Iowa. On top of that, I had very good support at both academic institutions that I was going back to. One was the University of Michigan, where my former chairman was very supportive, and the job I took in Iowa, the chairman there was very supportive.
Do you think without that support you would have gotten to where you're at today?
No. Both of those individuals have been very supportive of my career and have put me in positions of leadership to show my capabilities, and probably the reason I was able to elevate myself to chairman at the University of Iowa.
As chairman, do you do special things for those students that you mentor, either medical students or even the college students, to provide them support as they consider this field either in medicine or in ophthalmology?
Well, yes, I advise a number of students. I would say the majority of students I advise are probably majority students. When a minority student comes through, you definitely give attention to them because I think they need it more. They have less mentors in the field. I'm very honest in what I think it takes to succeed in our field, especially in ophthalmology. Participate and lecture to the SNMA group at our institution. And that's always fun to hear the perspectives of the minority students that work their way through medical school. So, no, I participate in that regard. I think it's sort of my duty to give back to the minority students, or students like myself. Not to say you don't give to majority students, but there's plenty of mentors for them.
Why do you think it's important for students of color to go into medicine or ophthalmology?
Well, I mean, we need providers. We need care providers from all groups. I mean, we have a number of minority health issues that probably be addressed with people that are more comfortable with physicians that look like them, understand their culture. And also, I think it's important to provide diversity to the whole healthcare workforce for the entire country. I don't think we should segregate ourselves to just people who look or talk or think like you. I think it's important to diversify the workforce.
And in academia, were there any challenges that you faced going from assistant professor to full professor and chairman?
Probably the biggest, I don't think any of the challenges were due to the way I look. I think the challenge was balancing the work of doing clinical care, trying to work in clinical research, and to do scholarly work. I think the time commitment for that is getting harder and harder because of the financial pressures that are put upon us. So I think that was the biggest challenge. I think at the University of Iowa, I really can't say I faced a lot of challenges related to race or things of that nature.
And do you have any advice for the young student, either in middle school, high school, or college, going forward that they can take from this to just motivate them to pursue their goals?
I think the important message I would have for young people in high school and that level, the same one I give the high schoolers in my city, is that they need to learn to listen to people who've been there. I was fortunate enough to do that. I think people who develop mentors early in their career do better. I think there are hurdles that we could knock down for them that they don't have to knock down themselves. They have to understand the system and that they have to perform. They have to prepare themselves for the opportunity. The opportunity is only going to be there if they're prepared. And so I think having someone you can ask questions and understand what you need to do to prepare is the most important thing.
And how do they find these mentors?
I think the locale. You find physicians in your area. I found a physician in my area in accent ophthalmology. Went and spent some time with him. There are plenty of people in university settings and private hospitals. You just have to take a little initiative and look them up and call them up. Most people would love to spend some time with young people.
Well, thank you so much, Dr. Carter. Really appreciate your perspective. I think you're truly a role model that we can all aspire to be like. So thank you so much.
You're welcome. You're definitely kind.